Today, I want to chat with you about some of the lab values that might be askew in persons experiencing an eating disorder. My name is Shena, and I am a registered dietitian specializing in the treatment and care of persons with eating disorders. When we are examining the lab values of a person's with eating disorders, some of the things that we might see that might be askew would be electrolyte abnormalities, deficiencies in kidney functions, deficiencies in liver function, micronutrient deficiencies, and changes in cardiac function. So let's explore some of the very specific lab values that may indicate that a person is at risk during their eating disorder. The first thing that I want to note is that for most individuals, their lab values will never be askew despite the severity and duration of their eating disorder. This does not mean that their eating disorder is less severe or less life threatening, or that immediate treatment is not warranted. The body is just, for most individuals, very good at compensating for deficiencies, and therefore, most lab values for most individuals will not be askew. However, if we do see lab values that are askew, this is simply an indicator that immediate intense intervention is definitely warranted and that there is compromise to some of the body's vital organs. Some of the tests that I recommend for persons with an eating disorder are a CMP or complete metabolic panel, a lipid panel, a magnesium check, and a thyroid test, including checking free T3 and T4. So let's dig into some of the lab values that might be askew for an individual with an eating disorder. One of the first lab values that we might see off for a person with an eating disorder, even in the very early stages of their eating disorder, is changes in their blood sugars or their glucose levels. Many individuals might be completely oblivious this is happening because it's often not something that they're checking. But low blood sugars can happen very early on, in that even if we miss a meal or two, for some individuals, their blood sugars are going to drop rapidly. This may lead to disorientation, difficulty thinking, headaches, dizziness, or in extreme cases, the inability to speak or slurring words, coma, or death. So even though this is a very early sign of clinical lab abnormalities and is common for many individuals, for some people this can be life-threatening. So it is something to be taken seriously. But low blood sugars is one of the first indicators that a person might be engaging in eating disorder behavior. Some of the other lab values that we might see shift pretty rapidly early on if a person is engaging in something such as self-induced vomiting or laxative abuse include changes in sodium, potassium, and magnesium. Low or high sodium, potassium, and magnesium can indicate that the person is intentionally purging through use of self-inflicted vomiting or diuretic use. And this can create really rapid shifts in those lab values, which can be dangerous. A person that is engaged in self-induced vomiting or diuretic use might also exhibit low or high chloride levels. And the low or high chloride levels can also be an indicator that a person is experiencing kidney insufficiency. Other lab values that might be askew for a person with an eating disorder include low or high total calcium levels, which might indicate a breakdown in bone mineral density. A person might experience high B12, which might indicate a kidney insufficiency. Some other clinical indicators that a person might be experiencing an eating disorder include a low heart rate or a very rapid heart rate. A person might also experience low blood pressure. A person might also experience extreme shifts in their blood pressure from the time where they are sitting down to the time where they are standing up. Extreme shifts in blood pressure between sitting and standing is an indicator that that person might be experiencing malnutrition.